I trained in medicine and initially specialised in internal medicine on an academic track, but after some time realising that I would be spending the rest of my life in laboratories, even though the problems that my patients were facing really lay in the living conditions, the situations in which they were living in Northern Ireland, I realised I needed to do something different. I was seeing patients with scurvy, with beriberi, with many diseases that were clearly caused by the situation in Belfast, and I wanted to do something about that. Initially I wanted to do politics, philosophy, economics, but I realised that the job security was a little bit better with the medical degree. In fact, I think I managed to combine the two pretty well. So perhaps I might be a political scientist, political commentator. Some people might say I do that anyway. I think the biggest challenge that we face in public health today is to address the dominant narrative in politics and in the media. Up until the 1980s, there was a view, there were two worldviews, essentially socialism and capitalism. And in 1989, it's clear that one model of socialism, that in the Soviet Union, was failing and had to be replaced. But in the last 20 or 30 years, we've also seen that the model of rampant capitalism has failed equally. It's failed to bring about a growth in living standards, just as communism did in the 1980s. Median income hasn't changed at all in the last 3 decades. To the extent that we have had increased prosperity, it's been for the 0.01%. To the extent that living standards have improved at all, it's been entirely by greater female participation in the workforce, by working longer hours, and by debt. So the model that we have at the minute, the market-dominated model, clearly is not working. It's not delivering what's needed for ordinary people. We need to address that. But then the danger of trying to do that is that you're portrayed as being some sort of a dinosaur or a communist or something like that. It's almost heretical to challenge the dominance of this rampant marketisation of our lives. So I think that we really need to address that from a public health perspective. I think people are beginning to see that we need an alternative. They're beginning to realise that we are ruled by a political class that is totally out of touch with ordinary people. A situation where all but 2 members of the current cabinet are millionaires, who have really no idea of what it is like to live in breadline Britain today. A number of the policies that they're putting in place are clearly not working. They're making things worse for ordinary people. The bedroom tax as an example. So I think that slowly but surely people are realising that there has to be an alternative to create a country where life is fairer, where people who work hard are rewarded, and not one that is organised for the interests of a tiny, out-of-touch elite. Interestingly enough, Scotland has been at the forefront of advancing public health, perhaps because its ministers have not had to be diverted by foreign wars, by the work in the international arena. It's been able to concentrate on what matters for its own citizens and has done very well. There is a danger that they will get diverted, but on the other hand, I'm a strong believer in the right of nations to take charge of their own affairs. I think some researchers should be advocates. I don't think everybody finds it particularly easy, particularly comfortable. If you do stick your neck out, you are likely to find people who want to chop it off. So you do need to recognise that often you're challenging powerful vested interests. They may not like you. I think if you are comfortable being an advocate, you should do so. We should recognise that within academia, we should have a number of people who can advocate effectively. I'm not sure that we often do it terribly well. I think there are lessons that we need to learn, in particular the ability to react quickly, react in the evenings, react at weekends, because if you don't, you get left behind. But I also concede that there are many very excellent academics who don't feel comfortable doing it, probably wouldn't be very good at it, but they are good at what they do, and they should probably stick to that, but work with people who can be greater advocates. The paper that I'm most proud of was published in The Lancet. It was a study that we did that disclosed the existence of a secret testing plant owned by Philip Morris in Germany. And this was run even as a secret within the organisation. It demonstrated the length that the tobacco industry would go to obscure the details of the evidence of the harmful effects of second-hand smoke. It was important because it was quoted extensively in the case by the US Department of Justice against the tobacco industry under racketeering legislation. And it was also influential because we published it on the day that the vote was taken in the Scottish Parliament on a smoking ban in Scotland, and a copy got into the hands of every MSP on that day, and my colleagues up here tell me that it did have an impact. I think that paper is probably the most effective one that I've written. I work in a lot of countries. I think with work I've probably travelled to about 100 countries worldwide. It's really difficult. I work with some quite remarkable people in many of those countries, particularly the countries of Central and Eastern Europe, people who have struggled against adversity, people who have struggled at great risk to themselves in many cases. So I clearly get a great deal out of seeing the changes that they have brought about. On the other hand, yeah, I suppose I could dream of the countries that I don't work in, and maybe some in the Caribbean or somewhere like that, but that's for another life. Generally, I'm a great fan of Twitter. I have a reasonably large following on it. But of course, you have to take the rough with the smooth. I've had an example in the past few days. I published a paper on what I consider the real dangers of failing to regulate electronic cigarettes. And within about an hour of my paper being put up on the BMJ website, I had hundreds of grossly offensive tweets from those people who are the greatest supporters of electronic cigarettes, portraying me as a vile cretin and much worse, dreaming about what they could do if they had a Gatling gun and the like. You have to take the rough with the smooth. But that's been quite interesting because I think I've been helped to understand much more where they're coming from. I think they're mistaken, but I haven't fully understood the ways in which they were thinking. So it's very helpful. And I actually get quite a lot of the information, my information from Twitter. I follow the links, people who tweet that draw your attention to papers that you might otherwise miss, I think can be very valuable.